Hi, I'm Dr. Jeff Hall, international speaker and myth-busting orthodontist. In this video, I would like to discuss what orthodontic records are required for an orthodontic patient. The orthodontic records that we require on the typical patient are: we need really good quality photos. We need good quality intraoral and extraoral photos. They should be of such quality that you don't even have to be in the room and see that patient, and we can show that to anyone else and they can diagnose from those photos. We also routinely need an OPG and a lateral cephalometric radiograph, so we can assess whether there's any missing teeth, whether there's any abnormalities of the roots, or any other dental abnormalities. And with the lateral ceph, we need to assess the position of the upper and lower incisors. We need to assess their vertical pattern. We need to assess their skeletal relationship. Where is the mandible in relationship to the maxilla? So the lateral ceph will confirm our clinical diagnosis. In the past, we routinely took orthodontic study models, and I'm still going to recommend that to the average dentist. But if your photos were of such high quality and they were absolutely perfect, really orthodontic models are no longer required, because the photographs are doing the same thing, documenting exactly where that patient is today. Unfortunately, most people don't take the perfect quality orthodontic photos that we require. And they are the three standard records that we require for the average patient. But there are some patients that have other problems that we would need what we would call supplemental records. For example, you might have an impacted tooth, you might have an impacted canine, and so you would take a cone beam radiograph, or what we call a CBCT. And there are some patients who have really severe problems, and we need to decide which is the best treatment option for them. Do we take out one lower incisor? Do we take out two upper teeth? And now we can do what we call orthodontic simulations on the computer to see exactly what movements are required in order to assess the best treatment approach for that patient. So we've got all of these options. And I explain to the patients when we need to do these orthodontic simulations that this is like building a house. I need to get the foundations right first. And if I can't do it on my computer, I can't do it in your mouth. So I'd rather experiment with these situations on the computer in the digital world. So we've now got all of these orthodontic records that can allow us to formulate the proper problem list and hence a proper diagnosis and treatment plan. If you want to know more about orthodontics, visit orthoed.com.au, the most in-depth and trusted orthodontic course in Australia.